Hi and welcome back to my channel. Today we're going to talk about symptoms of depression. I need to preface this by saying that please, even if you relate to some of these symptoms, it does not mean that you have depression. So I really urge you, if you have any concerns, please go see a primary care doctor, a therapist, or a psychiatrist just to consult, because you're going to have your own specific needs and everyone is case by case. This is just for information and education purposes, but please go and talk to somebody specifically about what's going on with you. Okay, now I'm going to use the DSM-5. This is what we use to diagnose people. It goes over the criteria of all mental health disorders. I want to make sure that I'm giving accurate information. To begin with, there are 3 different criteria that major depressive disorder has. The first one is you have to have at least 5 or more of the following symptoms, and they have to persist for at least 2 weeks. And at least one of the symptoms has to be depressed mood or loss of interest or pleasure in doing things. So this is what I'm gonna do. Instead of just reading to you word by word, I kind of just took notes to make it very easy to understand the 9, sorry, I put that in your face, the 9 symptoms that are categorized. So the first one is persistent sadness or low mood. Obviously feeling sad, empty, hopeless, and it has to be most of the time. Because we all have ups and downs, right? So just because you have a really bad day or a really bad couple of days, or maybe something happened in your life where you legitimately could feel sad about, that doesn't mean you're depressed. It has to be for 2 weeks or more, and it has to be consistent. The second one is a loss of interest or pleasure in doing things, meaning that if you used to always enjoy going to a restaurant to get boneless wings and watch football with your friends, and then all of a sudden you just stop liking it, you've kind of lost an interest in anything. You used to love playing the piano, now you don't play the piano, or you used to love going on hikes, now all you want to do is be inside. That loss of interest in doing things and having things that you enjoy being gone is another symptom. The third is change in appetite or weight. Some people, when they feel sad, they don't eat at all, like they just don't get hungry, they lose a lot of weight, or the opposite, food could become a comfort for them. The fourth thing is sleep disturbances, so difficulty sleeping or sleeping a lot. Sometimes if you're feeling sad, you're like, well, what's the point of getting up? There's no purpose in my day, and now you're spending a lot of time in bed and you're sleeping. Or the opposite, you could have a lot of things on your mind, you're feeling sad, you're crying a lot, your emotions are feeling up and down, and now it's hard to fall asleep. So a disturbance can go either way with sleep, and the same thing with weight. It can go up or down, both of them would count. The fifth thing I wrote is fatigue or loss of energy, which obviously makes sense. If you're not sleeping a lot, then it would make sense that you're feeling tired. If your brain is always thinking and you feel like you just can't catch a break and you're always feeling down, that could be draining, so that also can give you fatigue. The sixth one is feelings of worthlessness or guilt. If you start to feel like, I'm just not worth anything, I don't have purpose in life, what's the point of even going on? This just feels so pointless. Or if you're holding a lot of guilt, if you take a lot of responsibilities for things that have happened in your life that maybe is not even your fault, but all of that guilt is just weighing you down, making you feel sad, that's another symptom. The seventh one is difficulty concentrating. Again, I'm writing brief notes because I don't want to sit here and just read a book to you, but there is more information on this if you need it at some point. Difficulty concentrating, obviously that's trouble focusing on things. You might have a lot of things on your mind and it's just hard to focus on anything because you're constantly thinking of the things that have hurt you or bothered you, the guilt, all of that. It could be hard to concentrate, or you might just be feeling so drained and burnt out that your mind can't even focus on anything because it's like, hey, I'm tapped out. The eighth one is psychomotor agitation or being slower than usual. So kind of like restlessness. Maybe you just always feel restless, kind of like moving around. You can't find comfort or peace. Or the opposite, you might be moving really slowly because you're just so drained and you don't have it in you. You're like barely wanting to move. And then the last one is thoughts of harming yourself or ending your life. Now, just to recap and remind you, you do not have to have all 9 criteria in order to have depression. It's 5 or more of the symptoms, and everybody is different. And this is why it's so important to consult with a professional, because when you think about it, some of these categories overlap into other categories. For example, sleep disturbances. So if you have a lot of anxiety, you can have ruminating thoughts that can keep you up at night. Just because you have a difficult time sleeping at night does not mean that you automatically have depression. It could be anxiety Also, not to mention, it could be medical stuff. Sometimes if we have medical things going on, it impacts our weight, eating, it impacts our sleeping. There's so many different things. That's why it's also important to consult with a professional, because they'll be able to tell, okay, is this mental health? Is this physical health? Sometimes it's good to do both. So you might want to see a primary care doctor, get blood work done, make sure all of your levels are okay while also seeing a therapist. But those are the 9 most common basic symptoms when it comes to depression. Again, you don't have to have all of them, and everybody is unique, so you want to consult. Further than that, the symptoms have to cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Meaning, if your sadness makes you stay in bed a lot and now you're calling out of work and it's impacting your ability to work, or it's impacting your social life and your social networking, your social supports, because you're always inside and you're sleeping, and so you're missing all of these things that you used to enjoy. So it has to be impacting some area of your life. And then the third one is, this cannot be attributed to the psychological effects of substance use or other medical conditions. So if you are using substances, and let's just say, for example, you're using a drug that after the high, it makes you crash, it makes you feel down, you have a lot of negative reactions while you're coming down from it, that is not considered depression. That is you coming down from a substance. So there are different areas where you have to consider and talk to a professional, because there are caveats within this. All in all, if you feel like you are concerned, you should talk to somebody, because ultimately you know yourself best. You know if you don't feel right. Even if you're like, I'm not sure if I connect with all of those symptoms, maybe I do, but maybe I don't, but there's just something wrong. I think there's no harm in looking for help and having a consultation, because you know if you're not okay. And whether or not it looks good on paper or doesn't look good on paper, or whether or not everyone around you thinks you have a great life, if you don't feel good, you should talk to somebody. Sometimes I have people who come to therapy and they're like, Carissa, I don't understand. I make really good money. I have a good marriage. My children are good to me. I don't understand why I'm sad, like everything is fine, so I don't even know if I need therapy. Well, you probably do, because something is telling you something's not right. And just because you have a good job doesn't mean that you can't be sad, or just because you have a good family doesn't mean that you can't be sad. They don't equal each other out. It's not one or the other. And sometimes people will still feel a sadness, and it could be things that are lingering from childhood. It can be medical stuff, like maybe your hormone levels are off or whatever. So it's very important that if you don't feel like you're okay, or you have a concern, to please move forward with addressing it and doing the best that you can. I am only getting into the symptoms for today. If you want information on how to manage it, I have videos for that. I have a video, I'm pretty sure it's called Routine to Manage Depression. I also have a video, if you're not watching this because of your own depression, but you're concerned for somebody else that you care about, I have a video on how to address or support somebody who you think is struggling with depression. So if you need more information besides the basic of the symptoms, please go and watch those other videos, because there's more information out there. Even if it's not my video, you can Google it. I'm sure there's other YouTube videos or just information online that you can read about. Do the best that you can, and please take care of yourself. Book that consultation if needed, and I will see you in my next video.